Hi, this is Tingting from Drexel University. I am very pleased to talk to you about healthy aging in China. In this presentation, the topic of healthy aging in China is discussed primarily from the point of view of how social factors affect the subjective well-being of all Chinese people and what policy initiatives are in China. In 2022, China became an aged society when the proportion of the elderly population aged 65 and above reached over 280 million, accounting for about 20% of the total population. The rapid aging of the Chinese population is due to the declining fertility and growing longevity. Life expectancy in China has improved from 1990 to 2020. And this is because of the decline of various diseases. In this figure, we can see that life expectancy at birth has steadily increased from 74.8 in 2010 to 77.9 in 2020. Let's take a look at the subjective well-being of old people. It is considered one of the most important indicators of healthy aging. In traditional Chinese societies, family is a fundamental institution for supporting the elderly. An adult child is obliged to live with and care for his or her aging parents. However, profound social changes, such as declining fertility, increasing individualism, and migration have gradually reduced the traditional family support. Older people may face more obstacles than ever to maintaining their well-being. Social participation plays an increasingly important role in promoting the elderly's subjective well-being. In China, a growing number of neighborhood centers for the elderly have been established to promote social participation by providing a place for social contact and organizing various recreational, social, and educational activities. It is evident that old people who have better access to such resources have lower levels of depression. And China has also set up the first senior talent network to support the elderly in order to promote employment, education, and care for the elderly. Older adults who interact frequently with their neighborhoods and participate in volunteer activities experience higher level of social cohesion and enjoy better mental health. In addition to social participation, social networks are important social determinants of health and general well-being. Older women in China are happier than older men, according to some studies, and older people who live in cities are happier than those living in villages. Another aspect of social network is technological development. It is represented by the internet. It can connect people across distances and maintain or expand their social ties. Research shows that between 2011 and 2018, the number of people aged 50 and above using the internet has increased rapidly in both urban and rural areas, from around 15% to 50% among old people in urban areas, while in rural areas, the number of people aged 50 and over using the internet has increased from less than 1% to around 21%. The expansion of internet use is more pronounced among older people in urban areas. In 2018, around 55% of urban residents aged 50 and over used the internet, while the rate for rural residents was 21%. Older people are much less likely to use the internet. In 2018, only around 1.5% of rural elderly aged 75 and over use the internet, while 10% of urban elderly aged 75 and above use the internet. Something unique in China is that you can find social activity and physical exercise in one. That is square dancing. Square dancing is not only a physical activity, but also a social one. And it is a type of social activity for elderly Chinese where they perform various dances in public places. And this has gained popularity in recent years. And a recent study estimates that more than 100 million people in China square dance in their spare time. Most of them are elderly people. Square dancing has been found to be positively associated with cognition and mental health in older Chinese people. In China, we can see policy initiatives to promote the health and care by the government for old people. And these are reflected in two key programs. In recent decades, the Chinese government have introduced a number of measures that have a direct or indirect impact on the health of older people. In particular, China extended health insurance to all in 2003 and introduced a major healthcare reform in 2009 with the aim of giving all citizens equal access to basic medical care of adequate quality with sufficient protection against financial risks. The reform goals of the 2009 healthcare reform was further to expand it through the Healthy China 2030 strategy. And this blueprint of the Healthy China 2030 was officially introduced by the State Council in 2016. The aims of the Healthy China 2030 strategy are to improve the health of the population by promoting a healthy lifestyle, optimizing healthcare services, improving health safety, building a healthy environment, and developing the healthcare industry. The plan covers areas such as public health, environmental management, the medical industry, and food and drug safety based on China's new development concepts. And there are 4 core principles in this plan. And the first one is health as a priority. The concept of health has a priority in social development and certain circumstances. The second focus is on innovation. And the main view is the healthcare reforms in key areas could be accelerated on condition that market regulation is combined with the government leadership. The third principle is to foster scientific development in disease prevention, control, and treatment, as well as development of traditional Chinese medicine and Western medicine. The last principle is the promotion of equal access to basic medical and health services for all population groups. Fairness and justice requires a focus on rural areas. The way services are delivered needs to change to reduce the gaps in healthcare between older people in rural and urban areas. There's an interesting model under this strategy that is the 1973 model for developing long-term care system. China's traditional family support system for the elderly is under pressure due to increased life expectancy, reduced fertility, and the historical shift of the population from rural to urban areas. The establishment of a sustainable long-term care system is crucial, given that the aging population will continue over the next 30 years. A system that builds on and supports family care is urgently needed. As most elderly people continue to be cared for by their family members at home, the government has focused on expanding the long-term care system through a 1973 model. And it aims to ensure that 90% of all seniors receive the care they need at home, 7% through community-based hospitals and health centers, and 3% through nursing homes. And this has significantly improved access to care and services for old people. In addition, the introduction of long-term care insurance in 2016 has relieved the burden on the family of old people who can no longer live alone for reasons such as frailty and disability. In this picture, you can see a nursing robot chats with elderly at a nursing home. In addition to this long-term care system, and the strategy, the Healthy China strategy, there's an action plan to promote the development of meal services for the elderly. And it was initiated in 2023 by 11 ministries, including the Ministry of Civil Affairs, National Development and Reform Commission, and Ministry of Finance. The aim is to provide nutritious, affordable, and accessible social meals for the elderly to build a comprehensive, reasonable meal services networks for the elderly, covering urban and rural areas. By the end of 2026, the coverage of meal services for the elderly in rural and urban communities nationwide will be further improved, as will the services networks, and a diversified supply network will also be established. By 2023, a total of 18 regions in China at the provincial level have already implemented meal services programs for older people. Okay, in this presentation, I have given you a brief overview of healthy aging in China and the related policy initiatives. Thank you very much for the opportunity to speak with you. Thank you.